Good afternoon. My name is Chuck Feitel, President and Founder of Health Pro Realty Group. Welcome all of you to our fifth Lunch and Learn webinar in a series which will be continued monthly, which started back in March. Every month we try to bring in expert vendors who can help you with your business. This month is no exception. I'd like to introduce Dan Gramann, one of the co-founders of Cultivate Advisors. They're a business consulting firm that every year is a member of the Inc. 5000, the fastest growing companies in America, small businesses. They consult to small businesses. In 2019, their average client increased revenues by 108% and actually increased their net profits by 65%. The best way I want you to think about this is Dan's going to help you and speak to the fundamentals of running a business. As a doctor, dentist, or healthcare professional, you also run a small business. HPRG, we are engaged with Cultivate Advisors, and they help us with our profitability. And the analogy I'd like to make is that they are not commercial real estate brokers like we are, but they're helping us with the fundamentals, the ABCs of business, and they can do that for you. So as a doctor, dentist, or other healthcare provider, you are the expert and the expert clinician in doing what you do, but nowhere along the line did you receive basic training in the ABCs of business in terms of financing, staff, motivation, human resource, etc. So we have an obligation to bring in extraordinary vendor partners to help our clients. This is no exception. We're going to try to keep this to 30 to 40 minutes. I think you'll find it informative. So without further ado, I'm going to turn it over to Dan Gramann at Cultivate, and he's going to teach you about maximizing the profitability of your small healthcare business. Dan?
All right, thanks, Chuck. Thanks to HPRG for putting this together. Great to see everybody here on the webinar today. And there's a lot of folks that requested we send out the recording. So we'll be sure to bring as much value for the live time here, and then also make sure that if you are watching the recording here, that you get a ton of value in your own health practice. So once again, I'm Dan, co-founder at Cultivate. We started this business 7 years ago, and it's been quite the journey. What started out as a life in franchising, where we had to scale many franchises over time, we decided to start Cultivate Advisors, and we found right out of the gates, we had a ton of folks that were in different industries, people that were in chiropractic, dentists, realtors, every industry you could think of, that were coming to us on the fundamentals. And so when you think about owning a business, it feels like you're balancing and holding on to all the different hats of running the business, and it can be a bit overwhelming at times. So that's what we do. We're here to basically help pick up the pieces of the business side and really help on the fundamentals. So this is theoretically how we look at any business, no matter what industry you're in. If you look at the right side of this propeller blade here, you've got sales and marketing, and that's all about the growth of the business. How do we get leads? How do we get clients? And then what happens on the flip side is you got a whole new issue, and it's about capacities. And so now we got to think about recruiting the talent and how we lead our talent to make sure that we retain our clients, we retain our revenue, and have the best quality service for all of our clients. And then the big circle of productivity around it is no matter what blade you're in here, sales, marketing, leadership, or recruiting, everything is about better systems, processes. We're better with our time, our money, to make sure the business is running efficiently. So if you ever want to think about your business in a different way and go, which propeller blade am I great at, or my business is great at, and which are the ones I need to work at, this is just a good visual to think of as you look at your business and identify where to spend some time. So the purpose of today is to provide best practices and skills for managing your staff, ultimately increasing retention, profitability, and I call it quality of business, right? We always talk about quality of life, and if you've got a happy business, you probably have a happy life as well. And so today, the outcomes are that you take at least 2 takeaways on how you can better manage and retain your staff, your key people inside of your organization. Just some expectations here. I've got the chat box up here. I'm asking that everybody jumps on here, and from time to time, if I solicit any questions, jump on there. You can either privately chat it to me or send it publicly on there. It doesn't matter either way. I'm just looking for some response from the live crowd right now, and then so just jump on there as I solicit questions from you. There's also a Q&A button there, and that's for all questions to Cultivate advisors so that Chuck and the HPRG team can make sure they capture all those questions at the end, and they're going to make sure that they get that over to myself in case if I can't answer today, basically I'm going to try to get you all the answers following up from today. So, and then a parking lot basically is anything that will take us off course of today's focus topic. We saw a lot of votes come in from your registration of what topic you preferred. Today was mostly about leading, managing, and retaining your staff, but don't worry, we're going to get into other topics over time in the future. So if you have anything that takes us off course for today's topic, I'm going to throw it in the parking lot just to make sure I keep that for the future. So, and then post-webinar, just making sure when it comes to the recording and the slides, HPRG will make sure that you're in communication with them if you want to hold on to that. And the biggest expectation today is rocket science. This is not rocket science today. I'm going to say a lot of stuff that you kind of go, duh, or I already knew that. But what I will tell you, I find a lot of times with these sessions, there's always those little tiny minutes that happen within where it's like, oh, I haven't thought of it that way, or I actually have never heard of that. And I like that approach. It's a little bit different than the way I approach my business. And that 1 minute, if you apply that in your business moving forward, can be worth a lot of money over the years of the future of your business. So just making sure that you just understand, I'm not going to wow the heck out of you here today. It is not rocket science, but definitely capture those 1 minutes that happen throughout. So I got a quick funny story here for you. You know, pre-pandemic, back last year for Thanksgiving, it's a really big deal for our family to have a huge family gathering, something that's probably illegal at this point. We'll see how this year pans out. But everybody for potluck would have to bring something for Thanksgiving. And I thought I was going to go fancy this year. I went on Pinterest and I was going to bring this really cool Thanksgiving cupcake. And so I put all this time and effort into it. And at the end of the day, when I showed up, this is what it looked like. So it did not go to plan. And the reason I bring this up is because there are things that I had to go through the instructions from what Pinterest told me. And there's all this how to do it and the directions to go get this product to be right. And it still did not turn out right. Now, I missed the direction about keeping it in the refrigerator, so it kind of melted. And I think I missed out on some of the ingredients there. Why do I bring this up to you? I don't know if you've ever felt this in your own practice, when you're working with your key staff members and there's a very specific task that you're asking them to do, and you've got this vision of something like this cupcake, but it's the task for your clients or internally for your organization, and it ends up looking like this other cupcake here where it's just not the performance, it's not the output that you were looking for. And so today's going to be about how do we get better in our leadership, how do we manage better to ideally start to work towards what the vision was ultimately in the task that we're leading them on. So, and the one thing I ask you here today is we're all experts in different things here. As Chuck said, you are fantastic and you are the expert in your industry. What we're going to try to do is bring you some value on the other side, more on the business side. So if I can bring you that 1 to 3 minutes of aha that you can apply and make some more money for the future, that's the goal here today. So let's let go and jump right in. So again, we're getting into leadership, heavy on the leadership side, how to lead, manage, and retain key staff members. Why is this so important? So my quick question to you, jump on the chat. Why is this skill of leadership so important to you and your organization? Take a moment, jump on the chat, type out a quick statement of why it's important to you. And while they're typing that out, Chuck, I don't know if you are still muted or not muted. If you aren't, could you mute, please? All right, it's got some stuff coming here. Definitely on the time side, people are mentioning time, just how much it costs when you put so much time into employees. It costs money. They, at the end of the day, are the ones that treat our clients, and all of our patients depend on them to deliver at a whole new level. So if we don't lead our staff right, our patients feel it, and that's how they're going to judge us on our quality and how well we deliver. Absolutely. So I'm hearing more on the time, the money, the delivery to our patients. It is definitely an important skill when you lead inside of a business or even your management team. If you're not even thinking about yourself as a leader today, think of your leadership team that is also leading your staff. So look at both sides through the lens here today, no matter what phase your practice is in. So just to kind of break down what this does as far as the effect on the business, this is a good example of when you're trying to find a key staff member for your organization, just what kind of time is put in. So in a simple world, if you think about it, you got to get so many resumes and you got to leave so many voicemails and do so many phone screenings and do live interviews and do all the offer letters, the paperwork and the training and the coaching and all these things when you make a decision or find a key staff member, and it just adds up hours upon hours. And let's say the cost of hiring was by $50 an hour. I mean, if you lose one employee a year, you can see what that does, the trickle-down effect. 5 employees, if you're losing 5 a year, if you're losing 10 a year. Now, this is on $50 an hour, but let's face it, you are definitely worth it more than $50 an hour. So if you are involved at all in this hiring process, just think of the dollars that are lost on ROI for not being in what you are most valuable for. So think of it this way when it comes to time and money around why it's so important to really hone in on the leadership and the skills inside of your organization as you lead and retain your staff. The other side is just the quality side, right? And when we think of our key staff inside of our organization, who are the folks that, you know, are leaving the impression of why somebody even comes back as a patient to your practice? And so I'm using a very simple example of a dentist office here. And so if you think of the dentist and the hygienist, who do you think is probably the most vital person of these two when it comes to clients coming back to that same practice over and over again? Is it the dentist or the hygienist? Jump on the chat and share what you think it is from your perspective. Okay, I've got some mixed reviews here. It's almost 50-50 down the middle. You know, what's interesting is we get a lot of, we do a lot of polls with our clients. We do a lot of polls with clients, of clients, patients, and all that stuff. And what we find is, and even just my own personal perspective, when I think of the dentist that I go to, I try to remember who's my dentist's name again, but I definitely know the hygienist, Chris. She's amazing. She's phenomenal. She's the one that leaves that impression with me from the time she walks me to the chair and walks me back. I mean, I could get into very personal other things that I've had. Like when I did a colonoscopy, I can't remember the doctor that I went to, but I definitely remember the anesthesiologist and the nurse that was by my side that whole time. They were fantastic. They left an impression on me. Those are the folks that when you think of who inside of your organization is most vital to leaving that impression and bringing clients back for the future, those patients that you want to make sure you've got a lifetime of working with them. And so I just wanted to use that, and you'll see that I'll probably refer back to this as we work into more of the leadership skills, because I'm going to get into the 101 of how to identify how to lead your key staff members. So before I do that, I definitely just want to ask a really, really quick question to you. What is your biggest challenge or struggle when you think of leading your staff? Just take a moment, jump in the chat. What is one simple thing that kind of comes to mind for your challenge or struggle that you sometimes have in leading your staff? Motivation, absolutely. They don't just do what I ask them to do, or they don't do what I ask them to do right. Absolutely, right? Like in a perfect world, everybody would just do what we ask. They do it perfectly, and we all can just run a beautiful practice, serve our patients well, make money, and it's all good. But at the end of the day, it doesn't always go. Yep, another one, being a self-starter. We just wish that people would be self-starters sometimes too, as far as our staff, so we don't always have to lead them, right? So keep in mind, I want you to think, and you know, if you're using a pen and paper or you're typing on your computer for notes today, I just want you to think of and just keep a couple examples of some challenges that you personally have had in leading, or maybe your leadership team is having inside of your practice. I also want to talk about generation gaps. So I'm going to take a moment here, allow us to make fun of ourselves, all the stereotypes that are out there. We're hearing all about boomers and millennials, and if maybe you're an Xer or a Y-er, whatever you are, I'm going to talk about generation gaps right now because we probably can all identify that there's different generations and sometimes they have a hard time leading with each other, right? So in the case of boomers and millennials, again, excuse me for using some stereotypes here. We often hear about baby boomers. They push themselves through walls every day. They are the hardest working generation. If you want some, you just put your head down and you just push through and you work your butt off, right? And there's also the millennials. Millennials, they ask why all the time and they do the bare minimum. Everything's why, right? And so there's these different gaps of how we look at our work, right? Baby boomers get mad because millennials want something for nothing, right? And then we got millennials get mad because boomers taught them work smarter, not harder, but now boomers despise them for actually doing it, right? And so it's so funny when we talk with our clients all the time and we have a lot of discussions that are just the stereotypes and what their issues are between the generations, and these are some things that we hear all the time. And so when I talk through leadership today, if you are, whatever generation you're in, you're going to find that younger generations, they all need a different leadership style. There's a different way of working. There's a different way of approaching things. And so I'll be focused on more of leadership styles that whether you're leading a baby boomer, whether you're leading a millennial, it doesn't matter. These are definitely go-to ways and different ways of identifying what style you should be in as you lead them. So with this leadership piece here, if you enjoy reading and you like business books, you might enjoy a book from Ken Blanchard, 1 Minute Manager. And you're going to see him talk through 4 different styles of leadership to identify which one should you be using for who. And the 4 are director, delegator, coach, and supporter. And so with that, in the director style, the roles and the tasks are more defined. It's a one-way decision from the leader down, just giving very defined roles and what to do. And when it comes to the coach, it's more of a style where you're seeking ideas and suggestions and talking together. It's a two-way discussion and working together through something. When it comes to delegation and supporter, from the supporter side, this is just more about building confidence, motivating the individual, giving praise, and just keeping them committed. And when you get into delegator, it's basically a person on that task, it's very high trust, little supervision, tell them what to do, adios, we know it's going to get done, we know it's going to get done right. I used to solicit from the group at this point, go, which style is your favorite style? And everybody's like, well, of course, I love delegation. I would love to just tell people what to do, and it goes A-okay, right? But the reality is we have to be aware that there's different styles for different situations. And again, I trust that all of you situationally look at what's in front of you, who's in front of you, and you do go about changing how you lead them. But this will give you a little bit more thought process to it that I do believe will help you hone in a little bit more to get it right with very specific key staff members. So again, from a leadership standpoint, I want you all, whether it's pen and paper or on your computer right now, I want you to write down one person. Think of a person and a challenge you're having with them, okay? Specifically, I want you to think of a task that they're bad at. Maybe you've been working with them on it, or this thing just keeps coming back, or they're delivering something for your patients incorrectly, or you're getting whatever it may be. I want you to think of one person. They might be the front desk person. They might be, working next to you with the patients, whoever it is. Think of the person, the challenge. What is this specific task that's bothering you? It's not going the way you want. And when I say task, it's a specific job, a very specific chore, a duty that they do, and an assignment that you ask them to do, details, a mission you ask them to accomplish, which is very different from these are not tasks. So I don't want you to think of like a characteristic about the person. I don't want you to think about a trait or their emotions or their attitude or their aptitude. I don't want you to go down that road. I actually want you to think of like, what is the thing, the specific task that they're supposed to do that's bothering you on the delivery? So write that down, hold on to that because we're actually going to use this as I show you this process here today as you think through exactly like how to situationally lead and what style of communication to move forward with that person on that task. The next question is here, how long has this challenge existed? And what style have you been using, right? So I want you to take a moment, and I showed you these 4 styles here. I put some different terminology to it, but have you been a director on that task? Where again, you've got the defined roles, the task, but you've actually gotten into the step-by-step of how to do that task. Have you been more coaching style, where it's a little bit more collaborative, seeking their ideas and suggestions, working shoulder to shoulder with them in the task to coach them? Have you been more of a supporter? Have you been more just all about hyping them up, the high fives, giving praise, just motivating and giving them confidence, building that confidence? Or have you been more delegating style? You just trust them, hand off the task, little supervision, I trust it's going to get done. So how long have you been having this issue with that staff member? And what style would you say you have been using? I want you to write that down just as a starting point of where you're at. So then, from here, let's start to talk about how we break down our decisions and how we lead and communicate to our staff to really lead on a whole different level here. So typically there's 3 different reasons a task isn't done. Either 1, they can't do the task. 2, they just don't want to or won't do the task, which is a commitment issue. Or number 3, they don't know how. There's a skill issue. So when we think of task here moving forward after today, as you think about that task with that specific person in the example that you're thinking of right now, I want you to think, because we're about to break down skill and commitment that they have on that specific task. So, and then I'm going to break it down even further. So if I'm thinking of this person's commitment level on doing that task, I want to think of how willing are they to do the task, but also how confident they are in doing that specific task. And as I go deeper into now the skill side of things, we've thought about their commitment. I now want to think about their skill on doing that task. And that, I want to think about how much knowledge they have and how much experience, right? So we all know that there's moments in our life when we have the knowledge because we've read the books and we've seen it and there's been teaching behind it, but ourselves, have we actually had the experience of doing the task? So I want you to think of that in all the cases of these tasks for your specific staff members. So take a moment here, and I want you to go back to commitment, and when you think of that staff member, and you think of on a scale of 1 to 10, 10 being they're the most willing and confident person in the world, or 1, they are not willing at all, they have no confidence, where would you rank them on that specific task? Write down that number. And then now on skill, I want you to do the same question. On a scale of 1 to 10 for that person, that staff member, where would you rank them on a scale of 1 to 10 of being knowledgeable and having experience in that task? So 1 being they don't have any knowledge, they have 0 experience, 10 being they have so much experience, they've done it so many times, and they've got tons of best practice knowledge around how to approach it. Write those numbers down. So you take those numbers and you plop them here on the chart. So if you can see my mouse hovering over this here, you got the skill on the bottom and you got commitment on the left here. So if you gave this person an 8 out of 10 on commitment of doing that task, you're going to go right up here and just draw a line next to the 8. You can just draw this 4-quadrant box. And then if you gave them a 4 out of 5 on skill of doing that task, you draw a line here, you bring the 2 together, and you'll see that for that example I just shared, they would fall inside of this black box. So again, put them in whatever quadrant they're in. Are they going to be in black, blue, darker blue or green. Of course, I had to choose 2 blues, make it even easier for everybody here. So you've identified where they fall in skill and commitment. You've brought them together to dot where they fall in what quadrant. Let's talk about what this means now moving forward. So if they fell in the black box, like the example that I shared, commitment's high, skill is a little bit lower, it means director style, right? Now, if they fall in the high commitment and the high skill, that's where we can start to delegate. They are totally skilled. They are extremely committed. It's easy to delegate, and it's just going to get done, and it's going to get done right. If it's low skill, low commitment, we got to be more coaching. We got to be more shoulder to shoulder with them, jump in with them. And let's say they're a high skilled person with lower commitment. It's almost like they choose not to do it, even though they know exactly how to do it. We call them mavericks at times. That's where we need to get their commitment back up. We got to be more supporter to get their commitment back to where it needs to be. And so going through these styles again, if they fell in the black box for director, you really just need to explain more and validate with them exactly what the instructions are. Get into the details of how to do the task. For the coaching style, ask a lot of questions while you're working shoulder to shoulder. Have a discussion. Be with them in that task together. Work from their mindset. Supporter, maybe you've got the maverick. They're higher skill but low commitment. Listen to them. Ask them questions. Understand where they're coming from and maybe why they're not committed. Empathize. Understand. Spend some time with them. Sometimes it's as simple as grabbing a lunch with them, right? And having an open conversation about where their commitment is and why it is. Delegator. So that's the happy place we want to be. If they fell in the high skill, high commitment, don't over tell them exactly how to go do their job. They might get frustrated because they're great at that thing and their commitment. We don't need to get into the details. Just tell, ask, just focus on what to do, not how to do it, and you can let go and freedom, let them go. So we've gone through all these quadrants here. And I just wanted to emphasize, I skipped a little bit ahead here. When you're thinking about this a little bit deeper, if you are in a position where you need to be more director style with staff on that specific task, again, it's task specific, you got to get more into the how to do it. If you're in a delegation mode, you just got to talk about what needs to be done and it gets done. And again, if we are now in a mode because we got a maverick on this specific task, we got to spend more time on the why together and get to the meat of why this task needs to be done a specific way to work on getting their commitment back up. So that is more of the how, what, and why. So, and I just wanted to share this very simple equation. If you've ever had a staff member that just, they don't do what you're asking, take a moment on the buy-in equation of what might be holding them up. And so this simple equation works this way. And it's QI multiplied by BI equals EI. The quality of the idea multiplied by the buy-in of the idea equals the percentage of execution. So let's say I was working with Chuck, and I've got this idea for Chuck to go do this really great thing, this task inside of his business, and it's going to change his world. And I think it's a 10 out of 10 on a scale of 1 to 10. But Chuck is like, that's crazy. And he gives his buy-in is a 2 out of 10. Multiply those together, the execution on Chuck's level is going to be a 20%. He's not going to go do it. He's going to be kind of like, okay, sounds good, Dan. So just check yourself. There might need to be more of a conversation before you can align on the quality of whatever idea it is for the task and the buy-in of the person that you're leading. And that's going to ultimately help get the execution up on the percentage level. So explaining the why, I know I'm spending time here. If you've seen Simon Sinek's book, he talks a lot about the why, and it's definitely, if you're having any issues on generational gaps, maybe you're a baby boomer working with millennials and millennials are just kind of frustrating you, this book could be great for you. It really allows you to slow down and understand more on the why. And it's crazy if you think about where maps have even gone. Waze is almost kind of the map or GPS that we use that is more of a fit that explains the why for those millennials. It's because we've got traffic and construction and police here, so that's why we're going to take this route. The why is more explained versus some of our old school GPS. So it's kind of a fun visual as you think about the why. So that was more of the theoretical on the situational leadership style. Again, when you do that chart, when you think about skill and commitment for your staff members, don't say that that person's a maverick. Think of the task. It's one individual task. Don't put a title on their forehead. It's the one task that you're struggling with. They might actually be a rock star at a different task, and a totally different task, they are more of a maverick and they're not committed on that other task. So just make sure you're thinking task specific. I'm going to give you a couple tools here or things to think about of what are you doing inside your organization. And I'm going to wrap it up and hand it back over to Chuck here in just a bit. But before we do that, I'm going to give you a couple things that we have found of very high value for companies, whether you're doing this inside your organization or you might see that this could be done differently. A lot of great practices, a lot of great companies have accountability or support meetings with their staff. And they choose the appropriate staff that they want to have these cadence with them on a regular basis, one-on-one. Who are those key staff members that really should get that either weekly or monthly attention, that you got a place for both of you to communicate and not be so much on autopilot and be reactive in any issues? Where do you have that place together? When is that meeting? When is it consistently? It allows you to humanize the relationship and make sure that you're also bringing support and direction to go be amazing and grow in their career as well. And a simple way of holding accountability and support meeting is check in, build a rapport with them on that front end of the half hour. How are they doing in the past week or month, whatever period you're doing your weekly or bi-weekly meeting? What are your goals here this week? You can even talk about any specific admin items that need to be touched on in there. Wrap up, decide on any support or training or direction needs to happen outside of that. And then again, you just keep doing this either weekly or monthly with that key staff member, and you can formalize it a bit more. We have a lot more training material on really getting into the specific of making powerful meetings. I'm just giving a quick glimpse here today. So some other leadership systems to think about, do I or do I not have this going on in my practice? Transparent communication, career paths. Do you have very clear career paths mapped out for people as they join the organization so they know how they can grow in the organization when it comes to development, when it comes to money, all those things? Is that mapped out? Because if you don't, think about how you can start to build that for the career path, because people like to know how they can work the path. Training. What styles of training do you have when you onboard your staff, but also what continued training do you have? Training doesn't stop after the first month, 3 months that they join the organization. It's a constant thing. So rethink, when should I have my recurring continued training for people that have been here for a long time, and what should that be on? Coaching. Where do you actually spend time inside of a task, very important task with your staff members to improve their performance and move that skill needle? And then the development plan. It's basically, do you have a plan that you're aligned on with that person of very specific tasks or skills that you want to work with them on over time to get them skilled up so they can start to work that career path? So just some things to think about. What do I have and not have inside of my organization to continue to take my people, my staff, to a whole new level? So going to take a moment here. If you grabbed one nugget today, if you grabbed 2 nuggets today, something to think about inside of your own practice, what are the 1 or 2 biggest takeaways for you today? Jump on the chat. You can throw it to me privately or publicly. What is your biggest takeaway from today's leadership session? Yeah, different ways to think about what style of leading people, absolutely. And thinking through, basically, am I giving them just what to do, or am I getting into the how to do it if they need more direction or a more directive style? Absolutely. Whatever those nuggets are, keep writing them down. Write them down for yourself. But more importantly, when are you going to take a time or a moment on your calendar to just revisit that note that you just made, to go, I'm going to make some intention of making some small changes or tweaks on the leadership side inside of my organization or the way you lead yourself? So I'm going to take us here to the next topic here. So, Chuck and the HPRG team is going to continue to have webinars here, and you'll see them send out emails just to kind of get your vote and your consensus on areas and topics, good categories, things that would be high value to you. But I hope you grabbed something great today, grabbed that one nugget in this half hour to 40 minutes on the leadership side. And again, we all know this, if you keep your key people, if you keep your key staff, it is so much more time, money, and happy patients for you inside of your organization. Chuck, I'm going to hand it back to you.
Can you hear me? There we go.
Yep, I can hear you.
Dan, thank you for your time, and thank you for the participants for your time. You know it's valuable. I just wanted to add two things in closing. First, that in my 30+ years experience of advising healthcare professionals with their real estate needs, I've run into many, many consultants, and most of them are ex or retired doctors, dentists, or healthcare professionals. But in fact, if you think about it common sense wise, you already are a talented doctor, dentist, or healthcare professional. Where you most likely need the help is in just the running of your small business. So think of Cultivate as an advisor to small businesses. They have a myriad of clients. They've done this for many, many years. They've been helpful to us, and I highly recommend their services. In closing, any profitable business, real estate becomes a very important part of your business. And that's what we do. So whether it be reducing your rent, finding your property to purchase, finding a subtenant, or whatever, anything having to do with commercial real estate, you can reach us at www.hprgrealty.com to further address any of those issues, which are obviously a very valuable part of your profitability plan. Dan, thanks again. And all those in attendance, we appreciate your time, and thank you very much.